Hi, in this video let's discuss various important topics in pedodontics, right? So coming to the first subtopic, in child psychology and behavioral management, you need to focus on the following topics. So conscious sedation, we have questions on conscious sedation asked in AAPG 2015 and Karnataka 2003. Also we have questions on learning disabilities, right, asked in COMET 2013. And restraints used in uncooperative patients. So we have various restraints like Papo's board, pet wrap, etc. Right? So various restraints used in uncooperative patients asked in Karnataka 2013. And also we have various questions on behavioral management, right? So you need to focus on this particular topic. So example, we have a question on communication asked in COMET 2013. Next, another behavioral management related question on problem ownership asked again in Karnataka 2013. And also we have questions on rights classification of child behavior, positive as well as negative behavior, asked in Karnataka 2013. Next, Freud's psychoanalytical theory asked in COMET 2014. And various means to detect nitrous oxide leakage asked in AIMS 2014, and clinical manifestations of a Lesch-Nyhan syndrome, where we have the self-inflicting injury, right, seen among patients, asked in PGI 2013, and also a question on various stages of cognitive development asked in PGI 2013, and classifications of intellectual disabilities based on IQ, right, asked in PGI 2013, and also clinical features of autism, AIMS 2014. Pain threshold and tolerance asked in Kerala 2016, and various developmental milestones seen in child asked in AAPG 2015. So they'll give you a particular time duration and then they'll ask you, like in the options, which developmental milestones are seen, or which of the following are seen at this particular age except, right? And also we have questions on indications as well as contraindications of general anesthesia asked in AAPG 2015, and also a question on intellectual deficiency syndrome asked in AAPG 2015, right? So these are some of the questions from behavioral management as well as child psychology, right? So try to focus on these topics. Next, coming to restorative dentistry. So restorative dentistry, we have many questions on stainless steel crowns, their indications, the way in which they are prepared, various burrs used, etc. And also we have questions on in restorative dentistry. So before that we have this caries topic also, right? So we have many questions on different types of caries, common types of caries seen in child, and also many questions on early childhood caries, ECC, right, asked in COMET 2013 as well as 14. And also we have questions on caries assessment test, that is American Association of Pediatric Dentistry Caries Risk Assessment Tool. So we have certain criteria, just go through that table, asked in AIMS 2013. And also various criteria for selection of stainless steel crown, as I mentioned prior, asked in AP 2016, PGI 2013 as well as Kerala 2015, right? So we also have questions on chemotherapeutic plaque control. Chemotherapeutic plaque control asked in Kerala 2015, and chemomechanical methods of caries removal asked in COMET 2016. So these are some of the topics from caries as well as restorative dentistry, right? And then coming to traumatology. So in traumatology, we have various topics covered like subluxation. We have many questions on subluxation, lateral luxation. So subluxation, a question was asked in PGI 2011. Lateral luxation, a question was asked from in AAPG 2014 as well as NEET 2013. And various avulsion media, the classification and different types of avulsion media, and the best avulsion media available based on availability and based on the ideal case scenario, right? So asked in COMET 2010 and PGI 2011. And treatment for avulsed teeth. So based on extraoral dry time, based on the condition of the apex, whether it's open or closed, right? So we have questions on the treatment aspect asked in PGI 2011. And also we have certain questions on fractures of mandible asked in AAPG 2012, fractures of mandible in children, right? So these are some of the topics in traumatology. And then coming to pulp therapies, so pediatric endodontics, we have a lot many questions on root and filling materials asked in AAPG 2010, various obturating materials used in deciduous teeth asked in KSET 2009, and also we have questions regarding scientist names also, like who coined the term ECC, early childhood caries, or who advocated complete pulpotomy, or who advocated certain modifications in stainless steel crown, or who advocated a use of appliance associated with stainless steel crown. So we have even scientist names being asked, right? So you need to memorize them as well. And also we have questions on radiographic changes in chronic pulp infection. So various radiographic changes seen in pediatric patients when there is pulpal or periapical pathology, right? So these are some of the topics from pediatric endodontics, right? And then coming to various diseases in child, so we have various disorders, like, so as I mentioned prior, we can have questions on various clinical features, like clinical features of autism, clinical features of Down syndrome, right? And also we have questions on interproximal plaque, the pH, asked in APG 2012, and occlusion in patients after treatment for cleft palate, asked in APG 2012, treatment of ENUG, acute necrotizing ulcerative gingivitis, asked in AAPG 2012, and also we have a lot many questions on various prenatal and postnatal causes of blindness, asked in MSET 2014, and clinical features of ataxic cerebral palsy, asked in GSET 2014, right? So you need to focus on clinical features of certain syndromes as well as diseases. And then coming to various miscellaneous topics, they have asked like the respiratory rate of a child of a particular age. So we have, depending upon age, the respiratory rate varies, right? So you need to focus on that. And also the clinical consequences of ankylosed first molar, deciduous molar. And also we have question on pacifier sucking, asked in PGI 2013, and also various criteria to be taken into consideration while administering certain NSAIDs or any drugs in case of children, asked in AAPG 2011. And also we have question on various prerequisites for functioning of an efficient Pitt and Fisher sealant. So for to have this Pitt and Fisher sealant, what are the prerequisites that are necessary to ensure success of treatment, asked in NEET 2013. And also we have questions on, as I mentioned prior, indications, contraindications of general anesthesia, asked in 2012, and also local anesthesia administration in pediatric children, especially the maximum recommended dose of lidocaine or the common complications of local anesthesia, and also various drug interactions which we see along with local anesthesia, right? Asked in COMET 2016. So these are some of the important topics which you can focus on while you're going through or while you're preparing for periodontics, right? And regarding standard textbook references to be followed in weekly schedule, we'll try to cover that in the next subsequent videos, right? Hope it's clear.